Good morning. So today I want to demonstrate how to perform vital signs. The first thing we want to do is gather our supplies. We have our stethoscope. We had our pulse oximeter. We have our blood pressure cuff. We had our watch. And then we had our hand sanitizer. We had our gloves, and then we had our disinfectant wipes. So we will clean all the items that are not disposable, and then we perform hand hygiene, and then we will wear the appropriate PPE if necessary. Now, what are being collected during the vital sign measurement? Well, we will take the patient's blood pressure, the heart rate, the respiration, and the oxygen saturation, along with the pain rating. So I arrive at the patient's room and I perform hand hygiene. I already washed my hands, so I just use the hand sanitizer. And then I'm gonna introduce myself. And then ask the permission to the client for what I'm getting ready to do. Well, hello, my name is Luzelle Shetler. I am an occupational therapy assistant student. So today I'm gonna perform a vital sign. Is that okay with you?
Yes.
Okay. So the next thing we wanna do is find the client's identifier. So to do that, we're gonna look at the client's wristband. And then we're gonna ask them to tell us their full name and then their date of birth. So after that, the next thing we have to do is to do the ACS thing, which is pain. We're gonna ask the client their pain level. This is very important, especially if the client has a surgery or some kind of trauma. So to rate that is we most commonly we do that by using a 0 as no pain at all and 10 being the worst. So we're gonna ask the client. So can you tell me your pain level right now, being 0 has no pain and 10 being the worst?
It's 0.
Okay, so the client has a 0 pain level. But let's say he said he has 8. Then we're gonna ask more questions. Where is it located at? And then please describe. Is it radiating? Is it burning? Stuff like that. And then we document our numerical findings along with the location and the description of the pain. So the next thing we're gonna do is find the patient's oxygen saturation. To do that is we're gonna use this portable pulse oximeter, or we can also use the other one that is connected to the bedside monitor. And to do that is we're gonna find the nail bed of the patients, and then we're gonna put that there because that's where we're gonna get the reading. So we make sure that we choose the finger that has nice circulation and that is warm and soft, and we're gonna place that there, and then we turn it on. And then we're gonna wait for the readings. So the patient has 96, and so the normal oxygen saturation is in between 95 to 100%. So we will clean the device and then we will document our findings. And then the next thing we're gonna do is to take the patient's pulse. And to do that, we're gonna be looking at several things. Of course, we will be counting the rate, but we also going to be feeling the strength of the pulse, and we will be grading it from 0 to 3+, with 0 being no pulse, and then 1+ being weak, and then 2+ being the normal, and then 3+ being bounding. And then we also have to consider the rhythm. Is it regular or irregular? So to do that, we're gonna, most common adult, we can find the pulse at the radial artery. Below the thumb in this wrist area, that's where we can find the pulse. So we're gonna use our 3 fingers to find the pulse. And then we will count them for 30 to 60 seconds. And then for the regular, we will multiply them by 2. Okay, so the patient's heart rate is 72, and the normal is 60 to 100 beats per minute. And then the respiration, I already talked them while I'm taking the pulse as well. So the respiration is 18, and the normal is 12 to 20 beats per minute. So, and then after that, we will document our findings. So the next thing we're gonna do is to take the patient's blood pressure. And to do that, we're gonna find the brachial artery. We wanna make sure that the patient is, if he's sitting down, is gonna be the arm is on the heart, above the heart level. And then we're gonna make sure that the arm is supported and the legs are uncrossed. So we're gonna palpate the brachial artery, because we're gonna put our readings over here. That's where we got our readings. So we're gonna use our 2 fingers to palpate, and then we will put our make sure that make sure that the arrow is pointing to the brachial artery. And then we also make sure that we have the right cuff for the patient, because if it's too big or if it's too small, and it's gonna alter our findings. And then just relax. Like that. And then first we're gonna estimate our systolic number. And to do that, we're gonna palpate here the brachial artery, and then we're gonna inflate our cuff. Inflate our cuff, and then we will take note of the gauge and the number until we don't feel the brachial artery anymore, because that's gonna be our systolic number. So we have 100, and then we're gonna add 30 for that. So we have 130 for our estimated systolic number. Now we're gonna use our stethoscope to get the actual blood pressure. And we make sure that the first dab of the first sound that we hear is our systolic number, and the second, which is the last sound, is the diastolic number. So we're gonna put this at our brachial artery. And then we're gonna inflate. And then we're gonna release that slowly. Okay, so the patient's blood pressure is 118/62, which is 118 is the systolic number, and the 62 is the diastolic number. So the normal pressure for the systolic is 110 to 119, and the diastolic normal pressure is 60 to 79. For the elevated blood pressure, the systolic number is 120 to 129, and the diastolic number is less than 80. For the hypertension stage 1, the systolic is 130 to 139, and then diastolic is 80 to 89. And then for the hypertension stage 2, the systolic is greater than 140, and the diastolic is greater than 90. So let's wrap up our vital sign demonstration. And then we will take off our device, and then we will clean them. And thank you so much, sir, for your patience. Thank you so much.
Thank you.
You have a great day.